Welcome to Your Health. Information about today's top health topics direct from Brigham and Women's Hospital experts. We want to remind you that this information should not replace the advice or recommendations from your healthcare provider.
Hi, I'm Elliot Israel. I'm a pulmonologist and an allergist. I'm a member of the Brigham and Women's Hospital Asthma Research Center and the Partners Asthma Center, and I'm Associate Professor of Medicine at Harvard Medical School. I've been asked to talk today about common questions that people have about their spring allergies and how they may affect their sinus and nasal symptoms and how they may affect their breathing as well. Allergies are really the body's reaction to inhaling or coming in contact with certain foreign substances to which people are, quote, allergic. And so when people have allergies, when they come in contact with things like animal danders or pollens or dust, they may have these type of allergic reactions. They may be in their eye, they may be in their nose, and they may be even in their lungs, and produce kind of asthma symptoms when they happen in the lungs. So why do people who have allergies possibly do worse in the springtime? Well, if you've got allergies to pollens, especially to grass and tree pollens, the spring is the time that the grasses and the trees bloom, and when they produce their pollens, and so those pollens are in the air, so you may have increased symptoms because you're coming in contact with those pollens. So people wonder what they might be able to do with the fact that they're having these increased pollens in the air. Well, what you can do is try to decrease the entry of the pollens into the house, so you can keep your windows and doors closed. You can also try to clean the environment in the house or the air in the house by running the air conditioning with filters or running air cleaners with filters to help decrease the amount of pollen, so that decreases the amount of exposure and hopefully can decrease your symptoms. People also wonder what they can do in terms of medications for their either itchy eyes, runny nose, or for difficulty breathing. And there are a few different things that people can do. You can take antihistamines, which are available over the counter. There are also prescription eye drops that can help in terms of decreasing the itchy eyes that can develop. If you develop breathing problems, you can use your reliever inhalers, and if you know that the spring is a season when you develop increased asthma symptoms, you can actually even start using your preventative inhalers just before the spring season starts. And that's also true even for people with nasal symptoms. We know that if you use the nasal preventative medications, like nasal steroids, if you start using them a week or two before the allergy season, you'll find that you'll actually get better relief through the allergy season as you continue to use them. You know, if you're having a little bit of sniffling and some itchy eyes, and you take an over-the-counter medication, an over-the-counter antihistamine, and you get pretty good relief, there's really probably not a necessity to see a doctor. However, if you find that the over-the-counter medications really don't do it for you, or you're still feeling miserable, or if you're having significant problems with your breathing, where you're short of breath when you try to exercise, or short of breath when you try to mow the lawn or do things, you may want to consult your doctor to see if you need other medications in addition to the over-the-counter medications.
Thanks for watching Your Health from Brigham and Women's Hospital. A reminder, Your Health is intended for educational purposes only. It should not take the place of advice or recommendations from your healthcare provider. If you have questions about what you've heard, please consult with your doctor.